Late Night Dwight. I own a couple of restaurants in Muskegon, Michigan. Like most restaurateurs, we didn't believe that there was a program out there that we could afford to have all our employees be involved in it because insurance is just getting so high. This particular program makes it so that even our waitresses, dishwashers, and everybody can afford some health insurance. And in this day and age, to be without health insurance is like to be without a car. Everybody kicks in, everybody wins, and that's what we like to see in the good old USA.
When I opened the Glamazon, the premiums were just so outrageous that I knew it wouldn't be something that we could offer, and so I was kind of in a dilemma at that point as to, you know, what are we going to do? How am I going to draw employees? What's going to keep people from leaving?
People said, yeah, I could probably do something, but it has to be under $50 a month. So we knew we had a business willing to contribute $50 per employee or something under 50, and we had individuals willing to participate with something under 50 that could be used to help pay for benefit.
Oh, there's a big old sign, big old billboard, bottom line, $49, house coverage.
Our state was leaving money on the federal table, so to speak, and the state said, we'll let you pull it down. And that match money then becomes the community share of the 3-share. So $150, you know, we wrote our own contracts with our own providers. We set up a 501c3 to administer the program, and we created our own health program. No HMOs, no, you know, government-run thing, something with community oversight, and 97% of our doctors participate, and both of our hospitals participate, and hospice participates, and behavioral health providers participate, and people are mainstreamed, and they've got a pharmacy benefit, and our co-pays are low, $5 to see a primary care physician. We had over 400 businesses that participate. Just about 60% of them never offered a thing ever.
Just that easy, and then it was just up to the employees and myself to decide, do you want the coverage or not? And like I said, you'd have to be a fool not to, because it's so inexpensive. So it's a great program. You know, it's for a lot of different reasons, I think. For people that don't have insurance and for, you know, small business. Perfect. Perfecto.
I have to give your mom all your papers and things.
Access to medical specialists has long been a great barrier for uninsured patients. Our solution in Middlesex County was to work with MPS, an association which includes 90% of the county's physicians. Together, we invited the private practices to adopt a sliding fee scale, similar to those used by our health center and the hospital.
We are a medical practice, and we do not have the expertise nor the time to make these decisions, and that was always something that we found very difficult, because it's important that we're fair and the right determination is made.
In the past year, more than 50 physicians representing the major specialties have signed on. Other communities have gone a different route.
You do the best you can to fix them at the primary care level. If you can't, they end up in the emergency room as their only alternative. What do you do for that specialty care? So we solve the problem, and many of the specialists in the Hillsborough Healthcare Plan participated in this pro bono work because they felt it was their duty to the community.
Sure.
So when the plan came along, most of them said, heck, I'm going to get something where I was getting nothing.
And it's organized.
And what they did is they said, you know what, I am now, instead of able to see 5 patients of yours a year, I can now see 45 patients of yours a year. The plan really is a great model. And the other thing that I think benefits the plan is the recipients through sales tax are participating. Granted, maybe at a lower level, but everybody pays into the plan.
Yeah.
So even the users of the plan. Now, Florida's unique.
And anybody potentially could become a user of the plan.
Anyone potentially.
They're above for the grace of God, or any one of us without
that
insurance.
is very true.
Best known is the system of charitable care developed by the American Project Access Network.
What's happened here in Asheville in Buncombe County has been that we've taken the existing players in the safety net and we've strung them together and created a continuum of care system. We have gone from providing medical care homes to 50% of our uninsured to providing medical care homes and access to the full continuum of care for 97% of our uninsured.
we're looking at taking what we're learning with Project Access and then the Jesse Tree model and trying to do and implementing them together. So actually Ted Hanley, Director of Jesse Tree, and Alan McKenzie, Director of Project Access, are very excited about that possible approach.
And in talking with Ted Hanley, he believes that there's a lot that we can build off of the development work that they already did on the IS system.
The ability to automate referrals and to track them, which seems very much in line with kind of where we're going with our IS development.
Is there a way that we can start really pulling all these together? And that's where personally it really excited me, because I see all those linkages as part of the 100% Access project.
So we're able to take something that felt predictable, because these communities have been able to achieve some of the outcomes that we were hoping to achieve, and make them bigger than they were on their own by blending them together in a unified strategy. Where Communities Joined in Action really helped us, it actually builds towards a larger national movement where people get recognition and feel like what they're doing is part of something greater.
The challenge for our project, as for others around the country, would be to integrate best practices and add our own variations to the mix.
The group I was working with never thought they could get a federal grant, a $400,000 grant. I mean, it just seemed unthinkable. And sure enough, we did. And now people are learning that we're part of the national environment, we're part of the state environment, we're very much part of the local, regional environment.
From a faith-based perspective, I'm saying love your neighbor, take care of everybody, nurture them, meet their needs. From a healthcare perspective, they're saying manage that disease, keep them out of the ER. From an economic standpoint, the legislators are saying, quit spending those Medicaid dollars, save that money. My job is to figure out how we get everybody to the table. In this day and age when there's so little money, everybody wants to put the money into direct services, and by God, most of it needs to be there. But if you eliminate the ability of communities to sit down and do this work, you miss out on some of your best, most cost-effective strategies that allow you to increase capacity in any number of ways, as well as find innovative solutions to community problems.
I try to use what we learned. We've served about 16,000 people in our Regional Access Program. Take those stories, have them add up to something, make sure that these people don't get lost as we think about the future, and then also to use the patterns that we see across those 16,000 people to help us build a better system.
I do believe we'll find the best solutions that fit our communities if we can do this locally, and if we can communicate with each other readily and easily about best practices, about new ways of doing things.